Well, certainly we've had an increased number of phone calls with questions about symptoms, about medications, access to different supplies. Trying to give people some accurate information has increased for sure our workload, but we seem to be managing so far fairly well. Basically, we're giving our clients the same recommendations that we're following. So, follow all the information from the local, provincial, and federal health authorities. Washing your hands frequently is, of course, the best defense. So, washing your hands anytime that you've been out in public. Hand sanitizers are a good alternative if you don't have access to soap and water, if you can get them. We currently are out of stock of hand sanitizers, but that might change hopefully in the next week or so. Social distancing is as well important. So we're encouraging people to either ask for delivery if necessary or to maintain appropriate space between one another. In the store, we have two distinct seating areas, so that actually is helpful to sort of spread people out. So we're trying to as well just encourage people to kind of maintain a respectful distance. And if they're sick, certainly to let us know about those symptoms or to call ahead so we can advise them how to proceed. Daily, rapidly, I guess we could say. So obviously the information that's out there is changing constantly. The situation is very dynamic, so we're trying to adapt as well with that to make sure that we can supply our patients with their medications and provide them with some support for their health as well. So we've basically just continued to work as on our regular schedules. The store is open full hours and we're available to our customers for all of their needs, no different than we were before. Well, we will look at it as how can we support the public and the community right now, right? So we want to make sure that we help people to understand the seriousness of the situation, but also help to give them some reassurance, right? If they practice the social distancing measures and proper hand hygiene, that they can certainly reduce their risk. We also want to make sure that we can talk to people that are at high risk and give them some additional support and how to reassure them about their health and how to proceed if they are finding that they're experiencing symptoms of this or any other illness. So we want to make sure that we are an accurate source of information, that we've got good supply of as many things as we can in the store to support people. So whether that's over-the-counter remedies, prescription drugs, we've got no issues thus far with prescription drug shortages other than those that were occurring prior to the COVID-19 outbreak. So we're just trying to make sure that we're proactively thinking about our stock levels and our ability to provide for our patients. Do their part certainly to try and flatten the curve and make sure that we're limiting the community spread of this illness, and hopefully then these extreme measures won't have to be long term more than necessary. But if everybody just tries to remain calm and look to their neighbors, their healthcare professionals for accurate information, and also again seek out ways that they can get what they need, but with trying to minimize disruption. So like I said, we have free delivery like every other pharmacy I believe does. So we'll try to reach out to our customers in different ways and make sure that we help them access what they need.